I could tell you endless stories around that. Help, the importance of a family tree, filling that out. I talk a lot about and teach that in Patient Power School, how patients can pass that around. Get one smart, educated person in the family, fill out their family tree. They can be the scribe for everyone else in the family. You all have the same family tree. You just have a little different place on the picture. Give it the same fabulous thing to every doctor that you see. You've made a great gift, as I say, pay it forward. Chronic medical conditions. I have lists of, I have an agenda, I have what's called test results at a glance, one for men and women. Every data point on this sheet, this is for patients, just like doctors have in their offices and practices, these healthcare, little forms, the kind of little quick cheat sheets. This is a cheat sheet for patient. It puts the date and all the critical parameters, if you're a man or a woman. For the most part, they're the same, but a few differences, PSA, mammogram, et cetera. What it gives the patient a chance to do is not only check what their results are, they can, at the very end, put down what the target goal is. So if it's a diabetic and the target goal is under 100 for their LDL or A1C under whatever you're going to set, they and they're in partnership with whoever, the clinicians, can record. And so now they see at a glance what their results are, what the goal is, and where they're going in terms of changing medication, et cetera. These are probably tools that you already are using, it sounds like, but certainly out in the communities, this is not being done. Simplify. I heard KISS today. I've never heard that description of KISS. Keep it simple. Stupid, I heard, but you said it. Keep it simple, straightforward. Right, I like that. That was nicer. I'll have to learn to change that around a little bit. But I love this little joke that I saw. This is another New Yorker. Basically, this is how we look as physicians, the kind of directions we give to this cute little old lady. Have this prescription filled and take as directed. That was one of the number one numbers I saw in your bars of misdirection. People don't understand directions. Well, no wonder. 2 nights after the first full moon, that's what it sounds like to patients, the descriptions of things. No wonder they don't follow our directions. Or they have side effects. I did a recent GMA thing on statins, and the message boards lit up like crazy because there's so many people out there on statins who are having side effects. God forbid, I hate to tell you, but there are people who do have muscle aches, pains, do feel that mental fog. Their doctors don't believe it, don't take them seriously and tell them they're crazy. And I kind of talked a little bit about that. But what are patients doing instead? They're taking red yeast rice, et cetera, which may be equally harmful, who knows? They're not telling you because you're not believing them related to their adverse side effects. And so, of course, they're not going to report this other over-the-counter stuff. I can't believe how people are so eager and willing to take alternative natural treatments. That's a huge barrier. I'm sure you all face it. I'm shocked in the hormone literature. We have 60 years of estrogen data that's not that bad. I mean, really, and yet people are willing to jump on the bioidentical bandwagon, whatever that means, because a lot of prescription pharmaceutical drugs, like the hormones I take, are soy-derived. That's bioidentical, right? Or plant-based or something good. I mean, people don't get it, and that's where our job is. I have lots of stuff around medications. I say to people, I went too quickly. Don't take a medication without logging it in. Dose, directions, what's the goal? Get people, that's part of the involvement. Just getting people to tell them something is one thing. Then they write it down is another. Then they actually write down what the goal is when they get home and tell a friend or whatever, their health buddy. That really gets them going and gets them to understand it fully.